I sincerely believe that healthcare should be affordable, accessible, and excellent for everyone. And that's a radical statement because, as we know, healthcare is not affordable, accessible, and excellent for everyone in America. And using insurance-based models to seek primary care is a backwards way of accessing primary care.
New choices, new players, new models of care. You know consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer-first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. This is episode 345. I'm Jared Johnson, and here's what's going to go down today. We have the Flava of the week about CVS Health's new plans to locate Oak Street Health Centers side by side with pharmacies. Does this latest announcement by a payvider signal that there's new opportunity for profitable consumer-first care? And how could it impact the rest of the ecosystem along the way? I'll talk about that. Then I welcome back Dr. Paul Thomas to highlight the momentum behind the direct primary care movement and the revolutionary opportunities to break out of the insurance-based primary care model. It's time to dive right in. Are you ready? Let's go. Flava of the week. The new chapter of retail health that I highlighted last week continues with the latest announcement from CVS. On August 1st, Forbes' Bruce Japsen reported that CVS Health is rolling out a new store format in several U.S. markets. The format includes Oak Street Health's senior-focused health centers side by side with a pharmacy. What began as a pilot project in Houston last year is now beginning a national expansion, starting with 3 Chicago locations that are among about 25 Oak Street Health centers that will be alongside a CVS pharmacy in reformatted former drugstores by the end of 2024. The new format is being deployed this year in several other markets, and another 11 of the new formats with Oak Street Health Centers alongside a pharmacy will open in 2025. The idea is to offer seniors an array of primary care services, plus behavioral health, social support, and Medicare education, all in one location. Oak Street centers, which accept an array of health insurance plans beyond Aetna, also include a community room where seniors can gather for social activities and events. Let's highlight 3 key points from this announcement. First, probably the biggest lesson we've learned so far is that retail on its own cannot sustain a profitable business model in healthcare, which is why payviders might have a winning formula. Like Humana, CVS Health owns a health insurance company, so CVS Health's ownership of Aetna allows the company to offer incentives through its Medicare health plans to get seniors to use Oak Street Health Centers. Second, it could be said that the notion of scale is being downsized for national retail expansions moving forward. Profitability doesn't come as quickly as anyone expects, if at all, thus nationwide expansions might come at a slower pace. Back to the Forbes article, by 2026, CVS said Oak Street Health will have more than 300 centers, each of which has the potential to contribute $7 million of Oak Street Health adjusted EBITDA at clinic maturity. So at least they do have a target that looks scalable on paper. But it's probably safe to predict that shareholders will be in an uproar, if not a downright panic, if they aren't trending towards those figures in the next 1 to 2 quarters. Third, and most important to me, at the end of the day, we should remember that this move potentially highlights some of the best parts of retail health and could be considered a consumer-first offering. After all, this service appears to include more convenience, lower prices, and through Oak Street Health's value-based offering, appears to also have incentives that more closely align with personal health. So like Humana's move that we described last week, time will tell, and the economics could change at any point. But I'm still holding out hope that one or more of these payviders or any other national, non-traditional entrant will tweak the formula just right and show that consumer-first care can be profitable and sustainable, because we sure know traditional care never has been. Let's look more closely at how payviders can design and execute consumer-first care and how it could impact the rest of the ecosystem along the way. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. The flow. All right, everyone, let's get into the flow. This is really exciting to have a return guest. I was just telling Dr. Thomas how exciting that is for us because it feels like we're in a space of maturity with direct primary care, and we want to hear what that means and what that implies for those who are seeking care in these new ways. And there's a lot to talk about and a lot to dig into. So I want to welcome Dr. Paul Thomas back to the show. Paul, welcome back.
Jared, thanks so much for being here. It's a pleasure to be back in the space and to talk with all your listeners about the exciting developments in direct primary care.
I was looking it up and it was September of 2021 that we first had you on. So there are a few things that have changed in the space and just in healthcare in general. Can you tell us a little bit about who you are, what you're all about?
Yeah, Dr. Paul Thomas with Plum Health in Detroit, Michigan. And I sincerely believe that healthcare should be affordable, accessible, and excellent for everyone. And that's a radical statement because, as we know, healthcare is not affordable, accessible, and excellent for everyone in America. And using insurance-based models to seek primary care is a backwards way of accessing primary care. So we really believe that we should be delivering healthcare directly to our patients from our primary care office with excellent doctors and clinicians. And that's what we've done over the last 8 years that we've been in business, and we've continued to grow year over year, and we had a year of explosive growth in 2024, and we're really excited about that.
Cool. I was going to ask you if there was some good news you wanted to share with us, from your life or your work or whatever. Maybe I don't know if that's it, because I definitely want to ask about, the growth itself. Is there any other, good news you want to share with us before we get going further?
I think a lot of direct primary cares are entering this market of directly serving larger companies. And at Plum Health, we've done that as well. And we partnered up with several school districts across mid-Michigan, and we grew to serve not only our 1,300 members in Detroit, but now an additional 1,700 members in mid-Michigan, which was a big jump and a big opportunity for us, but one that we've been able to execute well and service these new patients really well in our mid-Michigan clinics.
Awesome. We'll dig into that here shortly. But how long ago was that? That was pretty recent, wasn't it?
February 1st, 2024 was the start date of serving those patients, those customers. And of course, there was a lot of behind the scenes contracting that started really in like November of 2023.
That is one of the ways that Plum Health has grown since the last time we had you on. Can you give us a little bit more detail? Where specifically has it grown? This is additional locations or additional clinics as well? Is it additional staff?
We have our Plum Health office in Detroit, where we mostly take on retail patients or people who are buying a Plum Health membership for themselves. We have a few like restaurants and small businesses that buy it for their employees here in Detroit, here in Corktown. But then these school districts kind of work in a larger group, and they contracted with us to run their clinics in Lansing, Van Buren, which is kind of by Ann Arbor, Ypsilanti area, and then Corunna, which is kind of by Flint, Michigan. Each of those sites has staff. So we have in total 5 providers at those locations, and then 5 additional staff, like 1 nurse, and then 4 medical assistants at those different locations. So it's a pretty large operation, and those 10 employees serve our 1,700 new patients.
What do you think is leading to this type of growth? Because, in a good way, I'm hearing about growth at other DPC clinics. I'm hearing about just the growth in general of this type of primary care. Is there anything in particular? Are these things that have been trending for a while and it's just enabling this to happen?
In large part, companies are facing double-digit increases on their health insurance premiums year over year. So most companies, if they're spending $1 million in 2023 on health insurance, it's now going up to 1.1 million or 1.2 million. So like a 10 or 20% increase. And that's largely unsustainable. We heard of one company that had a 37% increase year over year on their health insurance premium, and they didn't get any more care. And their premiums went up by 37%, but their deductibles stayed the same, and they didn't get an improved network or anything like that. It just held constant. And so it's absolutely mind-blowing in saying that these companies are seeing these kind of increases, and they are looking for other options to drive down costs, but also improve care and provide excellent care and service for their employees. And so a lot of these smart, forward-thinking companies are reaching out directly to direct primary care practices and asking how they can pair their health insurance plan with a direct primary care service or build their health plan around a direct primary care practice. And it kind of gets nuanced, but you can build it around you can build direct primary care in with a self-funded or a level-funded plan.
I see. So is it fair to say that really just the word is getting out more? The benefits are being communicated more. We're seeing, people are talking with each other and say, wait, how are you structuring this? What are you providing? And the word's just getting out more.
Just in terms of capacity, in 2016, when I first started my practice, there were only about 300 doctors doing direct primary care. And now there's probably close to 2,000 doctors practicing the direct primary care model. And then during that time, you've seen this whole health Rosetta movement. People like Dave Chase have been champions of the health Rosetta, where you're building health plans for companies around direct primary care and around direct contracting and low-cost meds and labs. And then on top of that, you're seeing this huge surge in health insurance costs. And I think that all of that together has been accelerating the growth of direct primary care and direct primary care doctors contracting with larger companies.
The timing's interesting, right? Because I feel like at least people working inside of healthcare are just looking at retail models, for instance, a lot more recently. Of course, timing is everything, right? The big announcement from Walmart Health shutting down their 51 clinics. So there's a lot of eyes on retail health and a lot of conversations that weren't happening even a couple of months ago that are happening now. And so I think the timing is interesting because I feel like that potentially also drives more momentum behind direct primary care, understanding that there's not an indictment on non-traditional care models. Demise of Walmart was its own thing. There are a lot of factors, and most of us don't even know the whole story yet. I definitely don't. And yet there's this opportunity. Yet now there's even a brighter spotlight shining on primary care that doesn't come from a traditional setup, like you said. An insurance hospital-based form of primary care. Are there other things you think might be shining a spotlight on primary care right now or fueling that growth? Has it changed much since the pandemic, for instance?
That's a great point. With the pandemic, we saw an exodus of many seasoned primary care physicians who didn't find practicing in primary care appealing anymore. So they retired early and they left medicine. So you're seeing fewer primary care doctors, period, in the United States. And that's problematic. And then I think people are waking up to the idea that traditional insurance-based primary care is a loss leader and that it's more of a loss leader for large hospital systems where large hospital systems want to buy up and own primary care practices. Since the pandemic, more primary care doctors are employed by hospital systems than are practicing independently. And that's very important for the healthcare consumer or the patient visiting their primary care doctor. Are you an independent doctor? Can you refer me to the best specialists around? Can you spend more time with me? Or are you going to be a referral driver for a large healthcare system? And I think people are waking up to that difference and realizing that when you see a doctor affiliated with big box institution that operates these huge systems, that doctor is not incentivized to cure and treat and educate and empower those patients to take care of themselves. That doctor is incentivized to refer within that system to the specialists in that system. And I'll give you a quick example. If you went in to see your primary care doctor with a bunch of earwax, that doctor could clear it out in about 10 minutes or 15 minutes at $5 or $10 or $50, let's say. But they are incentivized to refer that to the ENT for a $250 visit plus a $300 cerumen disimpaction procedure, right? AKA earwax removal. And you see that for a whole host of issues. It could be trimming the primary care doctor could easily trim toenails, but they are incentivized to send that to podiatry, again, for a $250 visit plus a $500 toenail trimming procedure cost, et cetera, et cetera. When you're practicing in primary care independently, you are incentivized to give great care and service to your patients and not refer them downstream to a higher cost specialist. And I think that's that more and more people are waking up to that reality.
I would agree. I feel like, again, kind of under this, the word's getting out, the benefits, the incentives that a provider has to provide care in a certain way are happening at an increased rate. And I do think that's one reason behind this momentum that DPC is having. And to that point, one of the things you mentioned earlier, a few minutes ago, was about how school districts, and you recently posted about this, about partnering with school districts and some companies, pairing your services with like a true insurance product. Can we drill down on that a little bit? Can you walk us through how that works and how that reduces costs?
When you are using a typical health insurance plan through your employer group, you're paying the insurance company to insure you to cover all those risks. And oftentimes you're paying, let's say, $1 million to the insurance company, but they're only paying out $700,000 in claims. So a smart business would ask the insurance company, okay, how much did you spend on our employees this year? And see what that ratio is. If you're paying out $1 million, but they're only spending $700,000 or $800,000, at that point, you should look at self-insuring or paying for your employees directly. And then, of course, purchasing some kind of stop-loss insurance. Or you can hedge your bet and do what's called like a level funded plan, where you're insuring yourself, but also purchasing an insurance product to hedge against larger claims, and while still having some kind of stop loss. Either one of those, self-insured or level funded plans, are going to decrease your costs for most people. And then when you pair that with the direct primary care service, instead of sending every one of your employees to a fee-for-service insurance-based physician, you're sending your patients to a direct primary care doctor, somebody that has an hour to take care of them, somebody that can accommodate them for same-day, next-day appointments. So now you're reducing your spend on urgent care visits, emergency department visits, and then you're treating medical concerns as they come up, rather than your employee waiting to go see the insurance-based doctor because they're scared of the copay. So when a smart company pairs direct primary care with their insurance plan or with a self-funded or level-funded plan, all the employees have to be educated. Okay, this is a $0 option. Every time you go see Plum Health, you're not going to pay anything out of pocket. The meds are covered, the labs are covered, the visits are covered, and then patients or employees are going to use that option, rather than, if something comes up, they might wait on seeing the doctor because they don't know what the copay or deductible will be. There's a stat that fewer than 50% of Americans have $1,000 in emergency funds saved up. And a lot of employees' deductibles are $2,000, $3,000, $7,000. So they might be scared of seeing the doctor even though they have insurance. So the smart companies are giving their employees a $0 option for primary care and pairing that with a self-funded or level-funded plan. Did I make that clear? I know that's a lot to take in one breath.
It makes perfect sense, especially when you consider what the options are. To your point about the proliferation of high deductible plans, and that thought of you got right to the heart of it, in my opinion, the consumer's choice at that moment when, should I go see the doctor? First and foremost, I don't know how much it's going to cost. And then secondly, I'm worried that it's going to cost too much, even if I know how much it's going to cost. I think I can live with, being sick. I think I can live with being hurt or whatever. Whereas the incentive change is right there as soon as you factor that into the equation. And that happens so often. It's happened so long historically that it's built on, like, that's not just something in a vacuum. That type of choice happens constantly every day. And when it doesn't take many times for that to happen in your life to be like, is it worth ever going? What would make me go seek the care that I do need, but I'm looking at it through this lens of, do I want to afford it? Even if, like you said, even having insurance.
And a practical, real world application is we try to remove all the friction from the relationship with these employer groups. So of our 3 employer group specific sites, one is near site, meaning it's in the mix of the Lansing Public Schools and Delta Township schools that we service. And then 2 of the sites, the one in Corunna and the one in Van Buren, are within the schools themselves. So if the employees need care, they just walk right down the hall. It has a separate entrance from the school, so we can accept members from outside the school community, but it's attached to the school itself. So if a teacher is feeling like, I have strep throat and I want to know right now if I have strep or not, they can come to the clinic. We can do a throat swab. It costs $20 to run that test, but it's of no charge to that employee. And they have an answer. And if it's negative, we give them supportive care. And if it's positive, we give them amoxicillin, again, for about $1, but no cost to the employee. These are the real world applications where you're taking somebody who's concerned about their health problem and you're just making it really easy for them, frictionless, to see their provider, to see their doctor, and get it taken care of right away.
There's a couple things I really like about this model, and I didn't realize that part about actually being connected or attached to the school building. Like you said, the frictionless side of it, but then also just this reminder that this is why no matter how many digital innovations are going to keep happening in healthcare, it still comes down to in-person care. And being able to remove friction in an in-person way is the future of all of this, in my opinion. It's not eliminating the type of care, it's reducing all the friction all around it. So I love, there's so much good to say about this model, it seems like.
I want to piggyback on that thought, if I may. With brokers, we talk with a lot of health insurance brokers, and oftentimes there's some perverse incentives there where they keep going along with the Blue Cross Blue Shields and the large insurance carriers of the world, because as those prices rise, their payouts are more, because it's like a percentage-based payout on the policies oftentimes. But we've talked with a lot of brokers, and when we present to them this idea, they're nodding their heads when we talk about like Band-Aid fixes, or like they get, like pain point, solution fatigue, or like little fix fatigue, where it's like some companies will develop an entire plan around managing diabetes, end-stage diabetes. But ideally, in an ideal world, those patients would have their diabetic complications prevented by having excellent primary care that's nearby. It's this point solution fatigue that these benefits brokers are seeing, where it's like, oh my God, are we going to add on another employee wellness? Are we going to do another diabetes program? Are we going to do another high blood pressure program? Are we going to do another step count program? It's like all these things can be really fatiguing when the solution is really excellent primary care that's readily available for you.
Exactly. And isn't part of that challenge that I have yet to find a program that fits everybody, that tries to be a one-size-fits-all solution to people. So, right, if it's a wellness program, we're going to reward you for your steps. We're going to reward you for this or that. There might be some incentives there. I've been in employer programs like that. In previous jobs, they were better than nothing. But did they deliver things in an actual like individualized way that incentivized those who needed it most, like those who needed the incentive the most, to act in a different way? And I think there's a lot of room to grow there. And I do see like the limitations of that if we're not challenging the status quo of how that care is delivered. So that's a great example, I think. Are there other aspects of direct primary care where it is right now and the care that you're able to provide to patients that are exciting you these days? I mean, are there other aspects of it that are like, that was really cool, or just something that you've experienced?
I just love seeing the momentum of the movement overall, where there are a lot of doctors who are looking to this as a way to get out of the typical insurance-based practice. Because as you know, doctors face burnout. They're unhappy in that treadmill. I only have time to make referrals. I don't have enough time to actually see my patients, listen to them, treat all their problems in one visit. I am having them follow up every month for a 15-minute visit after a 15-minute visit. And then I'm referring many of their problems to specialists when, if I had the time, I could take care of it myself. So it becomes this like, you lose some autonomy, you lose some complexity, and you can't really exert a bunch of effort to help people because it's so fragmented and fractured. So a lot of doctors are looking to this model as a way where they can either strike out on their own and deliver direct primary care on their own terms, or they can pair up with an existing direct primary care practice that has momentum, that's growing, and continue to grow this movement and this model in that way. And that's really exciting to me, because more patients are learning about it, more companies are learning about it, more brokers are learning about it, more doctors are learning about it. It's pushing the whole movement forward and accelerating the growth.
I'm thinking even kind of where that can take us. Like, what do you think the future of primary care does look like? Just, I don't know, maybe a few years down the road. Do you see more independent practices springing up? Do you see more partnerships with true insurance products like what you guys are putting forth here? Could some of this ever kind of be married to traditional care, with health systems, with incumbent care models? Where do you think this is all going?
There's two parts there. One is, I think there's an 80-20 rule at play where like 80% of people, companies, doctors are going to be okay with the insurance-based model. They know it's broken. They know it sucks, but they're going to keep on keeping on because that's the only thing they know, and it's too scary to jump over. Whereas like 20% of companies, patients, and doctors are looking at direct primary care as an answer. And right now, I said like 2,000, maybe 3,000 doctors are doing direct primary care. There's 100,000 doctors in the United States of America. So we have a huge opportunity to grow this thing. More physicians, more patients, more companies who want to adopt this. The other thing that I will say is we are seeing a really cool solution on how to integrate direct primary care with the larger model. And we're working with a team out of New York that's offering essentially like a debit card where if a direct primary care refers somebody to an orthopedic surgeon that's in a big hospital or independent practice, the company that we're working with will send them a debit card preloaded with enough money to cover that orthopedic surgery visit or procedure or injection or perhaps even an entire knee replacement. And we will pay the cash price for that service. Of course, this would be contracted with a large company as a part of the benefit plan, but we would provide the primary care and then we would pay cash to other providers in the marketplace, other hospital systems in the marketplace for that more complex care that can't happen in a primary care office. And the prospect of more companies adopting this type of model is really exciting, where we can pair the best primary care medicine with the best quality, lowest cost specialist care in the marketplace. And we're really amped up about that prospect. And we're looking to roll that out in the latter half of 2024 and into 2025.
All right. Well, I don't think I'm going to let 3 years pass again then to have you back on here because I want to hear how that goes. That is a true innovation that removes a lot of these barriers to getting that care you need and kind of have everyone aligned or involved at the very least.
A great word is alignment, that word alignment that you use, where we're aligning the best primary care option possible because you got a great DPC doc who cares about you. And then we're aligning the best specialist care that has great outcomes and also a known price. And so there's no guesswork. You're not going to get a balance bill or a bill after the original insurance bill because there is no insurance. Your company is just paying your direct primary care doctor and then the cost of the specialty service. So it kind of removes a ton of stress from the typical model.
There's a lot of innovation going on. This is really cool, which I love kind of ending on this thought or topic here, Paul, which is what our theme of our podcast has evolved into over the last couple of years. We like to spotlight innovations that help consumers live healthier lives. And we let people define innovation however they choose to. And I'm just curious what types of innovations you think we'll be talking about at this time next year. So I guess a shorter time from now. What types of innovations do you think will be?
I think we'll be talking about how people are breaking out of these bad contracts, bad models with these large health insurance carriers and putting patients and their primary care physicians first through models that uplift excellent primary care and that are removing some of those insurance middlemen that really just mark up the cost. And we haven't really seen this kind of innovation yet, but we're really excited for rolling it out here over the next year or so.
What a place for us to wrap up. Paul, this has been so enlightening. Again, our goal is to shine a spotlight on any way that healthcare is becoming easier. Not even just more convenient, I would say easier in every way possible, simpler. And all I've heard this whole time is a desire to do that very thing, which allows you to provide the high quality care that we are looking for. So I want to thank you for not only the care you're providing, but the leadership you're providing in the industry as well, giving us plenty to talk about here. And with that, that's a wrap for this episode. So I want to thank Dr. Paul Thomas with Plum Health and wish him good luck in everything he's got going on. Thanks so much for joining us today.
You're welcome. Thanks for having me on. It's been a sincere pleasure. And thanks to your listeners for, taking all this information. And I know it's a lot.